Hello, hello, YovinoMD Skin. How you doing? I think I want to clean this, make sure it's nice and clean. I'm a little fuzzy. How you doing, everybody? Hello, hello. We will just wait for Ashleigh to join us. How's everybody? And who's super excited for, everything to change? Me. Oh, here's Ashleigh. There she goes. So how's everybody doing? I'm going to wave to everybody. And we're going to get Ashleigh on here in just a second.
Hello.
Wait, hold on. Now I'm like squatty. Let me kind of move this. Can you see me?
I can see you.
Yeah, I'll go.
I love that hair.
I don't get the opportunity to blow it quite as frequently anymore.
Right.
But this is Nico Magic for those of you that know, a lot of my posts. It's Nico Warren. He's amazing. He goes by, I think it's at Nico Warren. Yeah. Mm-hmm. But if you do the hashtag Nico Magic, NICO, you will find him. And he has, dyed my hair.
That's good.
He actually just slapped it on. I ran home and had to do the rest myself. But he's awesome.
It's life right now.
It is life now. You got to do what you got to do.
You got to do what you got to do.
He was really pissed because when Corona first hit and I started getting desperate because I started seeing grays come through, mm-hmm. I ran to the store and bought like a box mm-hmm. of hair dye, and he wanted to strangle me. So
yeah.
we found
I haven't done anything to like my coloring my hair yet, but I did shave the back of my neck.
So somebody's asking, how young would you suggest starting Dysport, and does it depend on the person? It really does. So there's two ways to think about it. One is this whole prejuvenation thought is the millennial crowd that wants to prevent any signs of aging whatsoever. They're super educated. That's actually like, well, you're a little bit different, but they're super educated. They know who, they do their research. They know exactly who they want to go to, and they want to prevent any forms of aging. So they will start the Dysport before they notice any kinds of obvious forms of aging. So for those of you who are like, what's Dysport? Dysport is a neurotoxin similar to Botox. It is just by a different company. So, there's millions of grocery stores out there. There's pavilions. There's, it depends on where you live. This is kind of like the same sort of equivalent, but for a neurotoxin for paralysis of facial muscles and things like that. Mm-hmm. So Ashleigh loves it. I love it. It's a great product. But another option is the minute you start seeing a teeny tiny crack, like whether it's 11s or these horizontal lines across the forehead or crow's feet, you want to start using Dysport. Mm-hmm. So I've injected people as young as 20. I think I hear they say some people say different things. Some people say start early to prevent aging or wait until you see more wrinkles. That's correct. There's two schools of thought. You can jump on either one. It all depends on what you're willing to do. Some people don't want to pay for the product. It is on the pricier side. They don't want to pay for the product until they see that they need it. So there's my boo, Justin Yovino, must be done with the surgery. So there's two schools of thought.
Yeah.
But you can do things in the meantime to prevent the wrinkles from forming, such as products that really hydrate your skin. Mm-hmm. So a lot of times the wrinkles will form because facial loss, because of sun damage, because of multiple other things. Mm-hmm.
I mean, my personal experience, I started getting Botox when I was like 26 or 27, and I'm 35 now, and I'm really glad that. Oh, Dr. Justin's still in the OR. I was like, what?
Okay. Hi, Dr. Justin.
So I think it is like personal preference,
Right. I didn't start using it until I was 31. I had horizontal lines across my forehead. That's what bothered me the most. But some people have very dynamic wrinkles, which means, you know, a face that they smile and show a lot of expression. So they may notice it right here in the crow's feet area. They may notice it in the 11s. Maybe they have deep 11s.
Right.
I had a patient who was only 20. And she very beautiful face, but she had, you know, signs of sun damage and wrinkles all over her face. And we, you know, did a full treatment on her, same as if she was 40 years old.
Full treatment is how many units for you? Like what?
Well, okay. So if you're going to do Botox units, they have recommendations. Okay. So for the glabella area, which is right here, and that's what forms the 11s by squinting, and that is the procerus muscle, and the two corrugators right here, that takes about 20 units of Botox to fully treat it. Okay. With that said, some people don't have a lot of movement. Maybe they could get away with half of that. But in general, it's 20 units just for this area right here. Now you're talking about the crow's feet. Allergan recommends 12 units here, 12 units here. A full treatment is 24 units. The forehead is anywhere from 10 to 20 units. So if you say 20 units, 20 units, 24 units, that's 64 units for a full treatment. That's somebody who's on the older side. Somebody usually comes in and is like, I want a frozen look. I don't want to see any wrinkles. Treat me. Or they have very strong muscles, like men typically will need the higher side. Women, a lot of them can get away with, instead of 64 units, 40. And I do 8, 8, and 8, 12, and 12. Okay. That works fine. Yeah. It also like reduce in all different areas. You know, that's what I think I did for you. Yeah. I like frozen. It works. You're like raising. Dysport units. So Dysport's vial for a full vial comes in 300 units, and Botox, a full vial, is 100 units. So it's not like 1 to 3. So you can take those Botox units and multiply by 3 out of convenience. But what Dysport recommends is for every unit of Botox, it's 2.5 units of Dysport. But I usually do 3 units of Dysport, and then you get a little bit better of a treatment and a stronger treatment. People love it. Yay. So somebody asked about Kybella. Somebody asked if they got Kybella in the chin, would it make their skin saggy? And so that really depends on your skin quality and your age. So if you have very lax skin to begin with, in addition to the fat underlying it, you may need a little bit different of a treatment. And remember, Kybella is typically 2 vials per session with a minimum of 2 sessions. But when you see the photos online for people's before and afters, or even the before and afters that the company puts out, that's 6 treatments. Right. So when you start talking about 6 treatments of swelling like a bullfrog and contracting and having minimal change for the first 1 or 2 treatments, you might as well consider chin sculpting instead. Yes. You know, when you're talking about your, bang for your buck, we have a very hard time really selling Kybella in our office because we provide superior chin sculpting, with precision sculpt. Right. So when they realize, wow, it's going to cost $1,200 per session of Kybella for 2 vials, and I'm going to need maybe up to 6 treatments, maybe 2 won't even show really much of a difference. And then they find out chin sculpting is, similar in price, maybe a little less, plus you get internal skin tightening, right. Plus it's 1 time and you're done. It's hard to beat that. No one wants to go through that swelling, every month. Right. Yeah. I mean, I did Kybella and I was like a bullfrog. It was terrible. Really? It was bad. Oh my gosh. It was really bad. I haven't seen anything where I've been overwhelmed with the results, you know? So, so today we just wanted to touch on a little bit quickly because we know Father's Day is on Sunday. We wanted to touch on our men's regimens that we have. I have them right here. This is the gold. And you get the Ideal Cleanser, Sports Defense Sunscreen, and our
fan favorite filler in a bottle in the gold pack. And then when we bump it up to the platinum, we add this little guy, Wrinkle Erase
Which is Wrinkle Erase Serum.
Yep. And then our Retinol Super Serum.
So the Retinol Super Serum is a lower percentage of retinol. It's 0.25%. Plus it contains CoQ10 and vitamin C to help calm the skin down. So that one's great for sensitive skin.
Yes. Yes.
So remember, skin health is just as important as physical health. So some men really focus on their body and they look great, but their skin looks a little, you know, so we came up with 2 good regimens for men. One for a man that really, it has a hard time doing anything on a regular basis. And that is our gold set, because one's a sunblock that they're going to use when they're out and about. One is it's going to replace a regular moisturizer, which is our filler in a bottle. It is pure hyaluronic acid, 4 different kinds that will go and hydrate the skin. Remember, any filler that we inject is hyaluronic acid. So this, if you have fillers, is a great product to prolong the life of them. And then, what was the third thing? This cleanser?
The cleanser, the Ideal Cleanser.
I love that one. I use that. I put it in my shower. I use it every day. It smells like citrusy. I love that.
Yes. It's
the
one
other
of my
products
favorites.
don't have a scent. This line is called YovinoMD Skincare. We do know Obaj's line. We're not necessarily going to talk about their line because we're here to promote our own, which is great. So we have similar products, similar line, similar everything. Our line is made of, you know, the big 5, which is dermatologically tested and proven results. It's cruelty-free, not tested on animals, and free of parabens, sulfates, and formaldehyde, and contains all natural ingredients. So that's our line. It is medical grade. It is only available through our office and online through our website, and maybe eventually through QVC and HSN, but that's left to be said. And our line, I think, is great. And everybody who uses it rants and raves about it. And so we have many different regimens for many different skin types. So we have somebody that's watching, Ashleigh, that it has very sensitive skin, which you do as well.
Yes.
And so we should definitely talk about sensitive skin. And I can't remember if he said he had acneic skin too. Let me just see. Sensitive skin. Okay, yeah, sensitive skin. So one thing that we wanted to highlight today, we always highlight one product during our lives, is, Ashleigh, drum roll, going to be our Ideal pH toner.
Yes.
So we wanted to talk about sensitive skin and why people have sensitive skin. So sensitive skin is not a medical diagnosis. It is a reaction that people's skin has to either like an inflammatory response, or is sensitivity to certain products that are put on it. So do you have a sulfate mask in your line? No, we are going to have a pumpkin. We don't have any masks right now, right?
We don't.
No, we do. We have don't we have that? We have one, no?
No, but it's something.
So we talked about doing a pumpkin mask for Halloween that's going up, but we don't have a mask at this point. But that is on our works.
Yes, it's in the pipeline. And I don't, there is a clay mask. So they said that a sulfate mask in your line. It is one that is great for acne prone skin. The way that it detoxifies the skin and it dries up the acne. I've tried it before. And my skin is just sometimes all over the place, as you know, Dr. Sarah. And so my skin has, as far as like acne is concerned, has responded really, really, really well to our products.
Do you want to go grab the 2 acne products and then I'll kind of introduce the toner? Oh, you got them?
I got them right here.
Okay, so let's quickly talk about the toner and why the toner is great. So the toner is great for combination normal, dry, and sensitive skin. It is gentle and nourishing. It is a spray, which is great because a lot of toners are not a spray. So it's easy to apply. And what this is going to do, it's going to cleanse, it's going to clear, and it's going to prep your skin for any other skincare products that you may have. So that's really great. And to apply it, you do exactly what Ashleigh's doing. You're going to spray it on your face.
Oh, it's so nice.
You're going to take a clean, like a gauze pad or one of those, cotton pads, and you're going to wipe your face clean and look at it. If it still has dirt on it, you're going to spray yourself again, and you're going to take a clean pad, not the same dirty one, and you're going to wipe again until that pad, it has pretty much minimal dirt. So you're going to do your face, your neck, your décolleté, wherever you're going to put great products on top of, this is going to be your skin prep.
And just to let everyone know who's watching, when Dr. Sarah says face, neck, and décolleté, it's important that we treat all of this as one because the skin ages on our neck and our décolleté, and all of these products are designed to also treat not just your face, but your neck and décolleté as well. So that's also really important because these areas can be a little tricky as far as, exposing age and things like that. So it is important that when you are cleansing, when you are toning, or when you are, taking care of your skin health, that you treat face, neck, and décolleté.
Yeah, a huge common mistake that people make is they focus on this. And then they may go to right here under their chin, but they totally miss their neck.
Right.
And they miss, oh, my mom's here. Hi, Mom.
Hi.
I'm going to wait for her. Oh, I already did. Oh, no, I'm going to wait for her. They miss their whole neck and they miss their décolleté. So if you look, it's all dotted and spotted up, and then their face is clear. So it's like there's a mismatch that occurs. So you definitely want to make sure you treat, like Ashleigh says, as one big unit.
You taught me
Most
that.
people, and they wear a lot of people wear a lot of V-neck shirts. People wear a lot. This area gets so much sun exposure. Even when you wear a hat, maybe to the lower face you may cover, but then all this gets sun exposure. And it will show the signs of age. So you definitely need to protect it. And you definitely need to treat it with your products.
Yep. And so a great way to start
is with that toner. So that toner, remember, cleanses, clears, and preps your skin for any product that you may use. And what's great about it is it's gentle and nourishing, and it contains a lot of products that calm your skin down. So if you have sensitive skin and when you wash it, you kind of get these little blotches on it, this toner will calm your skin down because it contains all these amazing botanicals. So grapefruit peel extract, chamomile flower extract, aloe leaf extract, sage leaf extract, cucumber leaf fruit extract, and fennel seed extract. So it's botanically rich and a pH balanced toner. And so this will prep your skin for your medical grade skincare products to absorb way better than if you did not prep your skin with that.
What I really love about using the Ideal pH toner is when I get out of the shower and I, dry, or if I wash my face and I dry everything off, my skin usually feels dry, not almost instantly, but I don't like to put products on skin that feels really dry. I want my skin to be able to have some moisture in it already and to be nice and dewy before I put on all of my medical grade products. So I always use this toner, and then I start applying filler in a bottle, bye-bye bags, if I need a little bit of the Anti-Acne Serum, I spot treat, everything like that. This is suggested.
I'm trying to put down our website because people may be wondering where they can get this stuff from.
YovinoMD.com. And then to answer your question, you suggest after cleansing. Yes, you want to use the Ideal pH toner, ideally after you use the Ideal cleanser. But after any cleanser, it's really important to tone because therefore your skin will be nice and moist and can already absorb the medical grade products into the skin at a much higher rate. So that's really why you want to use a toner. It helps with the pH balance of the skin. So any sort of redness or anything like that, the toner is really going to help you with.
Yeah, it's the second thing that you use. First, you cleanse your skin.
Yep.
Don't use bar soap, please. You will over dry your face. Do
Yes.
not do that. And what happens when you over dry is your body does a reactionary thing and wants to produce more sebum and more oil because it senses that it's too dry. So do not wash your face with that bar soap, especially the bar soap that's in the shower. You need something that just sits in your shower. You wash your face with that and use the bar soap for the rest of your body.
Yeah. Yes.
You know. Okay, so we talked about the calming ingredients that are in it.
Yep.
It also, some of those ingredients like, you know, chamomile and all these other things are very relaxing. It will relax your facial muscles as well. So it is a great launch pad before you put on all your other products, depending on what your needs are. So we have somebody that's watching that asks us about acneic skin, and we have, well, 3 real good products. Let's first start with the ones that are dedicated for acne. You want to do that?
Yeah. So we have our acne defense pads, the anti-acne defense pads. These contain a lot of amazing acids in them. I've been using them because I know a lot of people right now are breaking out because of how we're having to wear masks everywhere, and I've experienced that. So I was like, I gotta get these acne pads because it worked almost instantly, cleaning up my jawline where the mask was kind of sitting on my face. So this is our anti-acne defense pads.
So really fast before you switch. So there's 60 pads in there. They contain high doses of salicylic acid, lactic acid, and glycolic acid, which I think they're 10% of each or something like that, which is, you won't find in anything over the counter. There's 60 pads. The pads are pretty large. So if you want a spot treat, you can cut that pad like in a plus and have 4 pads instead of just the 1.
That's what I do.
For 60, you could get 240 pads out of it. I love it. My teenage son uses it. He's breaking out, and he's got you know, clogged pores. It has like a waffle weave texture, and it will create a micro peel. So it will peel and lift off and unplug your blackheads, your whiteheads. It will decrease sebum production, and it will decrease your bacterial growth. So those pads are great if you have acne.
I've been using them every day.
Well, you know, for you, you're got sensitive skin. You might, you know, just be cautious because maybe that's why you're, you know, having a little reactionary thing if you use it every day. That might be a little harsh. That's more of like a spot treater, or like every 2 days to kind of slough off your dead skin and unplug your pores.
Okay, that's good to know.
So
when you say peel, I'll listen to whatever you say. When you say peel, like you mean like it'll help like
it will slough off your dead skin cells.
Yeah.
It will slough off the dead layer because it contains 3 different acids in it. And the acids will slough off your dead layer.
Okay.
So, and because the pad is kind of gritty, if you use it, you're kind of creating like a peel. You're kind of like sloughing off and like loofahing your face kind of.
And would this still work on your, like, if you wanted to maybe like peel the neck and chest?
Oh yeah. It uses people with back acne, people use it on their butt.
Yeah.
For like, you know, especially swimsuit season, the more daring you are, if you go to that thong, you know, you may want to.
Girl, you know, all of our patients are.
I know you just bought 3 pairs.
Yeah.
So, you know, you can use that all over the body. That's not restricted to just the face.
Awesome. Okay. So these are the pads. And then we have our anti-acne serum.
And that serum is easily spread around. You can spot treat with that as well if you want to use that. It's clear, isn't it? Or is it white?
It's white.
It's white, yeah.
But I mean, it's pretty clear. It comes out looking like that, but then I'll rub it in.
So if you're going to use the toner, you're going to use the toner first, and then you're going to use these products. And I mean, you're going to use the acne serum second. But if you're going to slough off your skin with the acne pads, you may want to use the toner, you know, after.
So those are our 2, but you said there were 3, Dr. Sarah. What was the third one that you wanted?
So the third one is the wrinkle erase serum. Controls your your oil production. So we call it wrinkle erase serum, but it is an acne defense, age defense serum as well. It will decrease your overall oil production by rehydrating your face. So that one's very good for that as well. It's great for acneic patients.
One of our best sellers. Patients love it.
The toner you can use twice a day, morning and night. Okay.
The other thing that I really love about this toner, and this is just something that since I've been using it, that I've done, and I don't wear a ton of makeup, but if I do happen to put some on right now, I will actually set my makeup with this toner. I'll just give a little final spritz, and it gives such a nice little glow to it. So
like a dewy look.
Yeah. So for anyone watching who was, I like to get the most out of all of my products, and this is one that you definitely has multiple uses. It's a great like refresher just to kind of like, keep your skin feeling hydrated and everything like that during the day. So this is one that I definitely keep on hand often. And it's a great value too, because this is a very large bottle. It's 6.8 ounces and it's only $33. And remember, when you shop with YovinoMDskincare.com, you get free shipping with orders over $100. So if you wanted to get, maybe for the guys watching, to pick up a men's, the gold or platinum regimen and then get a toner, that's definitely, you can get free shipping on all of those orders on YovinoMDskincare.com.
Great. Yeah, I love that. And I love the fact that it comes in a spray.
Yes. And it's a really nice mister. It's not like it covers, if you hold it far away enough, you get like nice one, it covers like the full face. So I'm big on the misters, and this is a really nice one.
Awesome.
Yeah.
Patients love that. Even so, we touch upon a few things today for those who are joining us late. We touched upon the men's skincare regimens for anybody that's looking for a gift for their dad. We have two. We have the men's gold, which is our basic one. It's the cleanser. It is the filler in a bottle, and it's our sunblock, so it's really great for that. And then we have ones that if your dad's a little bit older and you think he's more advanced and wants to take care of his skin, we have added a retinol and the wrinkle erase serum as well for our platinum kit. And both of those can be found at YovinoMDskincare.com. It's a great gift for your dad.
And also too, to let people know, there is a code. If you put in the code Father's Day, you can get 15% off of your order. So listen, you still have enough time to get that order in before Sunday. So if you have a man in your life who needs to kind of work on their skin, which I think most men do, and, we wanted to design these kits, for men to actually be able to realistically incorporate them in their lifestyles, which is why we created one with just the 3 items and then one with 2 more. So these are really what men need. It covers you the basics. If you're a little bit older, it covers that as well. So men need to jump on. You say, Dr. Sarah, skin health is just as important as your overall health.
Right, and your physical health. So you want to branch out and give a little bit of behind the beauty when it comes to lip fillers, since you just experienced it.
Yes.
So why don't you tell us about your recent experience getting lip fillers? I won't get mad if you say anything bad, but just remember who you're
So I think it was around a week ago. Anytime Dr. Sarah says, "You want to get my chair?" I say yes. And so I hopped in her chair, and my lips have been something that, I've gotten them filled before. But before it was always just like filler was just kind of placed in, and I didn't feel like there was much strategy. And with you and I have been kind of working on my lips, for like the last year or so. And we really changed the shape of the border up here and just enhanced my natural shape of my lip up here. And it was such a great experience because, you really, like, your technique is just so phenomenal as far as creating shape in the lift. on the lip, and just defining the areas that I want defined, and it doesn't ever look too big or too ducky or anything like that. It's always like the lip that I've been looking for. And the border work that you did this most recent time, I'm just like in love with, and I can't stop looking at the shape of my lip up here. I'm so obsessed with them, and you did such a great job. I'm so happy with them.
Yeah.
And yeah, I mean, I tell people all the time, whatever it is that they're looking for as far as an aesthetic need, whether it's the texture of their skin or enhancing the shape of their lip, people always get the wrong idea that it's if you get this type of work done, that it's going to look fake. And that's absolutely not true. If you go to the right person, it's going to look natural for your face. And so that's what I really feel like, happened with my lips this most recent time around. I really feel like we've made some awesome, like.
And how was your pain? How was your pain level during the injection?
I didn't have any pain. No pain.
And why didn't you? You didn't have pain because
we did a dental block, because I also got filler in through here. And so all of this I couldn't feel any of it. And so it's like, if you have any fear of that, you can just throw that fear out the door, because you won't feel anything. There's no pain.
So for those of you that are unsure what that really means, so there's many different ways of getting the lip filler done. Some people will put on topical, which, maybe for the initial seconds, it feels okay. But once you take that topical off, you start feeling that pain again. So for every little poke, you're going to feel it. So what I do is I do what's called a dental block, and I actually block the nerves inside the mouth, and then it renders the lips numb. So through the entire injection, the person's very comfortable and typically doesn't feel anything throughout the injection of the lip filler.
Yeah,
I didn't Ashley had that. She had the dental block and didn't feel me injecting. Can you get a little closer so people can see your lips, like a little bit closer? So Ashley was a work in progress, because when she first came to me, she had lip fillers done by another practitioner, and she had a lot of filler above her lip, which we had to dissolve. So anytime you see somebody and you think they may have like a ducky appearance, or they may have filler that doesn't look right, or they have obviously like filled lips, it can be fixed. It can be reversed, injected. The reversal agent brought the lips back down, and then the pink part or around the lips refilled. And that's what we did. I used Restylane Define on her because she really wanted a much plumper look, but there's multiple other fillers on the market, and the newest one being Restylane Kiss. That's the newest and latest one. It is with the same technology as Restylane Refine and Define. So some people think that, hey, I don't want my lips that full. I only want like a natural pout. Well, I've got fillers for that. If somebody's like, no, I want like, really, really full lips, I've got fillers for that. So there's these days, there's so many different fillers on the market for different purposes. Very soft ones that don't put a lot of water to them, ones that like plump like crazy. So it all depends on what you want as a final result, and we kind of edge towards those.
We get a lot of celebrities and influencers, and because of their work, they need to maintain a certain integrity of their face, but they also can't look too done. And so Dr. Sarah has really perfected this technique, and I always say she has a great hand, because she has a gentle hand. You don't experience a ton of, you don't get beat up and things like that. And if you're not wanting a ton of Botox, she won't do a ton of Botox. I really trust her technique. I trust her hand. She's, phenomenal when it comes to creating whatever it is that the individual is truly looking for. And that's what she did for my lips. I mean, I'm just like, and I've been, I've worked in plastics for a while, and I've worked for a lot of other talented surgeons, but when it comes to lips, I also feel like you need a woman's touch. And yes. And Dr. Sarah, just delivers day in and day out when it comes to our patients and getting their Botox and fillers.
Yeah. So and now skin treatments, because
even,
skin health is so important. You can have the best looking lips and you can have nice cheekbones, but if you're overlay, it's like having the most beautiful dress, but it's all wrinkly and dotted and looks like shit, you know? I mean,
Right.
This is my language,
Yeah.
but wait, hold on. Lynn just said, I'm still a little scared to get my lips done. This is great info. I sent my best friend to you last week. Oh, and Shani's lips look great. Yay.
Yeah, you know, I understand like being scared because it's, you know, it's a procedure and it's your face and everything like that. That's why it's like important to go with a trusted practitioner. You know, do your own research, check out people's Instagram, you know, so Dr. Sarah has a lot of her work on her Instagram. And a lot of our patients are like, yeah, post that, talk about it, you know, because
there was
so
a period of time that I was like, I'm never getting my lips done, because when I had gotten my lips done for the first time, there was those, I don't want to say the brand, but there's a certain brand that gives you a very waxy and big lip look that was like super popular maybe 10 years ago. So I don't prefer to use that brand. I love what Refine, Define, and Kiss does with the Restylane brand. I think it gives a very natural looking lip. I prefer that for injecting. And as you can see for Ashleigh's lips, her lips are super natural looking, but they're very full. And, you know, we recreated her you know, columns. We recreated her Cupid's bow. And she really wanted a lot of central fullness and a very full. I mean, it hasn't been that long. I mean, when did I inject your lips?
It's been less than a week.
It's been less than a week. So she's definitely still has a little bit of swelling, but I have a lot of patients that are like, whoa, that's a little too big for me. And we start out, there's fillers that aren't as plumping as the one I use for her. And we use the one that's not as plumping on somebody who's a little bit afraid. Typically, your first time you get lip filler, you can't handle seeing your lips super big. Right. So I have to pick a filler that's very soft and very natural looking and very smooth. So, you know, and we're very slow and gentle. And once you have that block and you don't feel the pain, really, it's easy. It's like going and getting your lips done. I mean, your teeth like at the dentist. Once they numb you and you can't feel what they're doing, it's like, okay, I can tolerate this. Yeah. And it's kind of the same thing with your lips.
Thank you.
Yeah, Ashleigh's lips look great. I think she did, you know, yeah, I think they look great. I was going to say she did a great job, but I'm like, wait a second, I was the one who did it. Yeah, so
come in and see us.
We do have topical for some people. You know, the one downside to a dental block, I have to say, when you do get that dental block, it's the same as when you go to the dentist. If you get that dental block, you're going to talk funny for a period of time after you get it. It's up to 2 hours. I mean, how long do you think your dental block lasted?
I think it was around 2 hours. 2 hours.
Okay. When my husband injected for my lips, I think it lasted like 30 seconds and I felt it. So it was a little bit different. But yeah, you can count on 2 hours. If you're going to get your lips done, don't come like 2 days before you have a huge event. You will not be happy. I'm telling you right now, you need to plan ahead. You need to come at least a week, maybe 2 weeks before any kind of big event, because you have to count on bruising. And don't go and have a big bender and go out and drink a ton, because you know what? Alcohol thins out your blood and alcohol will cause more bruising. So keep that in mind. If you're coming to get fillers, even Botox, try to like push alcohol aside for that weekend and get it done at the beginning of the week, so then you can, you know, have time to do it. Oh, my husband's saying, stop talking smack about me. I love you, boo.
Yeah, that's great. That's a great point, to make sure that you plan. You know, I bruise if I brush up against something, you know what I mean? I bruise very easily. And so for me, about a week before I have like an event or a party or something like that is usually pretty good. So a week out is usually pretty good, week to 2 weeks for sure.
So Michelle's saying that she's seen Dr. Justin, but not me. You know, I don't always get to see all his his surgery patients. Yeah. You know, because sometimes I'm out of the loop until they cross over onto the non-surgical side. But I'm here if anybody, you know, wants to see me too, and available, even though we are on a restricted schedule due to this COVID thing. Hopefully it all blows over soon, but just so people know what our process is. We have a big screening questionnaire. You got to pass all those questions. You don't have any of the symptoms of COVID. And then you come in and we take your temperature at the door. You get whisked right to one of the patient rooms. We don't have you wait in the waiting room. You go right to the patient room, which had been cleaned in between patients.
Mm-hmm.
We have you sign all this COVID paperwork and this and that. Then you get treated. We have you swish and swallow with a hydrogen peroxide mouthwash, which kills any virus or germs in the mouth. And then we go ahead and do your procedure and then whisk you on out. Someone asked, can I get Botox while getting liposuction? Oftentimes, I will wait till your liposuction is done. You come into the room with me, I inject, and then you can go home.
Yes.
If you're saying that you're already scheduled for lipo with my husband, then yes, we can add Botox on for after.
Yeah,
I don't want to do it during because he does like to have people change their position frequently. And when he does that, I don't want people, to get, love your TikTok videos in the past. Oh, yay. For those of you that know the Home Mentor, she has helped us with the TikTok. I have to give her credit for that. She has come up with a lot of my initial videos and has made the videos for us and then created our TikTok. And then we've kind of taken over for that. So thank you for, giving us props on our TikTok videos.
We love
that. Jasmine's been doing our latest ones and posting. She did the fat one, and she's been doing the ones with the lip fillers and the one with the skin resurfacing. So the last few, Jasmine, our front desk, our admin person has been doing those.
Yep. She's been doing great.
Okay. So I think that kind of wraps everything up.
It. So don't forget to visit YovinoMDskincare.com. There is free shipping on orders over $100. Mm-hmm. If you're still searching for that Father's Day gift, you can use the code Father's Day and get 15% off of your order. And then the other thing is, too, don't forget, for the men in your life, whether they're a dad or not, we have the men's regimens live on our website. And then get your toner.
Yeah. So the toner, remember, the toner cleanses, clears, and preps your skin for any other skincare products that you may put on afterwards. It's really good at cleansing, and then you spritz it on your face, you wipe, make sure that the cotton pad is clear, and then you can put on your other skincare products afterwards, whether it may be a hyaluronic acid, whether it will be your wrinkle erase serum, which will help increase your collagen elastin synthesis, or a retinol or something like that. It helps penetration of your products better.
Yes. And then the other thing too we should probably mention is, this is Behind the Beauty, and hopefully over the next few weeks we'll start having some guests and things like that to start collaborating with people and learning about, different beauty influencers, beauty influencer award shows, all of these things that we are working on to take you guys behind the beauty.
Yay.
Awesome.
Okay.
Well, we'll see you guys next Wednesday at 5.
Next Wednesday at 5. See you guys. Thank you for watching.
Bye.